Hello again. For all that I have a reputation among some people as a vile racist, a good number of those who contact me privately to tip me off about matters relating to immigration and so on that I might want to make videos about are not white people at all, but rather Hindus, Sikhs, and people of African heritage. In general, white liberals denounce me as racist because I do not follow the accepted narrative as it touches upon matters such as nationality, religion, and ethnicity. I mention this because I have for some while been in contact with a dentist whose family origins lie in South Asia. He has provided me with some very interesting insights about foreign doctors and the fact that quite a few of them are not up to scratch. If concerns are raised about a doctor's fitness to practice, he might be required to attend a tribunal which will look into the case and decide what to do. Sometimes he might be suspended for a few months, or perhaps they will decide that no action is necessary. In the description to this video, I give a link to all the hearings which have been held by such tribunals going back for some time. One does not need any special skills to work out the nature of the problem, nor does one need to be a statistician. I mentioned this in passing the other day, of course. As we know, the National Health Service in Britain is struggling to cope, and their chosen and short-term means of doing so is to scour the world and invite any doctors from overseas whom they can lay their hands upon to come and work in Britain. Most viewers who have visited a hospital in the last few years will know what this means in practice, which is people who can neither understand patients nor can they speak clearly in English. This is, of course, a very dangerous situation. Click on the link I give, and you can see at once the names of all the doctors who have been before tribunals this year. On January the 9th, for instance, Dr. Harish Rao was suspended for 3 months in Manchester for misconduct. Dr. Rao qualified in 2004 from Rajiv Gandhi University of Health Sciences. Then we have Dr. Onyekpepi in Islington, also misconduct, accused of having a sexual relationship with a patient. He qualified in 2003 at Kharkov Medical University in Ukraine, though he is himself African. Dr. Avinash Sukhdev of Camden, given a warning for misconduct, and so the list goes on. What becomes immediately apparent is that most of these people are foreign, and out of the 50 names of those who have faced misconduct or fitness to practice hearings so far this year, just 5, that is to say 10%, are obviously British. Here's Dr. Mohammed Asif, who qualified in 1989 at the University of Peshawar, Khyber Medical College, and moved to the UK in 2001. In 2006, he applied to take the International English Language Testing System and Professional and Linguistic Assessment Board exams, and has worked as a doctor since 2008. In January 2022, a tribunal heard an allegation that between 1995 and 2019, Dr. Asif was mentally and physically abusive towards Miss A and inappropriately involved himself in medical treatment. I could go on, but I suggest that viewers click on that link for themselves and they can see all the details of these cases and where all those doctors qualified. It is blindingly obvious that doctors who qualified overseas are far more likely to be facing such allegations than those who studied in this country. The NHS has taken people who became doctors in an obscure city in Ukraine and after cursory language tests set them loose in hospitals in this country. Here is a question which I would like viewers to answer honestly, regardless of whether or not it sounds superficially to be racist. If your child were gravely ill, who would you rather have treat him? On the one hand, a man called John Brown, who qualified as a doctor at Barts in London, or a man from West Africa called Eweri Oniekpe, who studied medicine at Kharkov in Ukraine. The problem is, of course, that for most people there is no choice, because they have to make do with whatever doctor turns up at the local hospital or comes to work at their medical centre. A third of doctors now practising in this country are foreign, which is absolutely astonishing. I'll give a link to this figure from the House of Commons library in the description to this video. That third of foreign doctors, though, make up around 90% of cases before tribunals considering fitness to practice. Can anybody see the problem there, or is it just me?